Oh, okay. How far are you into it?
Level 63.
So you've been playing for some time.
Yeah.
You've been putting in some work.
Yeah.
How many hours does it clock your hours? How many hours you play?
Not particularly.
I know a lot of those games do that. They clock how many hours, like if you put a save, it'll tell you how many hours you put into the game.
Online doesn't do that.
Oh, online, you don't have the story.
I do, but
Okay.
I prefer playing online.
Okay. Do you have like people that you play with repeatedly, or
Not
just
yet,
random?
no.
Random.
Random.
How are you doing with your medications?
They don't seem to be doing any good.
What about? You're not getting sick anymore, right?
I still am, yeah.
I thought that was kind of figured out. Like,
It's one of the pills that I'm taking.
so
I think it's one of the laxatives or something.
not prescribed any laxatives.
Well, something's making me sick.
Okay. So, have you reported that to staff?
Yeah.
Okay. So you don't think the medications are helping you?
No. I do not think that they are helping.
What kind of sick are you getting from the medication?
Diarrhea?
Every day?
No.
How often?
Like every few days, if that. It's weird.
Have you been doing Tai Chi?
No. I've been depressed and barely able to get myself to play the game.
How often are you sleeping?
Usually from about 10:30, 12 o'clock to about 12 o'clock, 3 o'clock.
Let's see if Chantel's still available. Because I want to make sure she's aware of these things.
Alright.
Oh, hey, so Bradford is reporting that he's getting sick 2 or 3 times a week, diarrhea, stomach. And he's also reporting increased depression and sleeping 12 to 15 hours a day and having no motivation to do anything.
Right.
I
definitely have noticed like this last week. He's up like between like after lunch.
Okay.
And he stays up. And I've noticed last week he hasn't been much.
Okay. So what do you think is causing this?
Things not getting resolved.
In what manner?
Improper medication.
Okay. But the medication hasn't changed. So
Right, it hasn't helped.
But your symptoms are continuing to, as you report, are continuing to get worse.
Right. So if like properly medicated would help.
Okay.
Finding some resolutions to what's going on. The fact that it's not being fixed is depressing as well.
Have you had contact with your guardian?
No, I've texted her a few times, but I haven't heard anything back.
Okay. So are you okay with Dr. Harrow again? I mean, after the last appointment we had with Dr. Noble?
A doctor who will give me medication that works would be very nice.
What's that?
Adderall or Dexedrine with Seroquel was what worked last time.
She didn't prescribe that, though.
Yeah, I know. It was prescribed before and it worked.
You're talking about the doctor in Wisconsin?
Correct. But, saying that the medication that she's giving me helps would be fraud.
Okay, so when we met with Dr. Noble, we had that second opinion medication review. And she was stating that part of the reason why that they're not prescribing Adderall is because Adderall is a stimulant, and you have a rapid heartbeat in a continual manner. It's usually like 118,
That's
119.
because my back is broken. And
Okay.
if I were not in as much pain, I bet you my heartbeat wouldn't be as bad. And
Okay.
I've already taken the medications, and they helped a great deal.
Well, that's
People saying that they
understandable.
don't help is
That's understandable,
ridiculous.
and I don't want to take that away from you, but just I want you to at least know what her main concern is that it could be a liability for her to prescribe that medication due to the medical.
Well, it's also a liability to say that I'm taking a medication that works when it doesn't, and they
Okay.
continue that.
Well, we can continue to. I can put a note into Dr. DeHaro to let her know. So the sleeping has increased.
Yeah, I have noticed that in the last week. His sleeping has
The
increased.
overall attitude, you would say, has been more depressed.
Trying to make the best of a bad situation.
Yeah, because I mean, his
I'm
his
friendly.
attitude and his and the way that he acts hasn't been different.
Okay.
Not to me. He's the same Bradford has always been. So, he's usually in good spirits. I have noticed. I even said that. What was it yesterday? I said, I haven't hardly seen you. You've been sleeping so much.
Yeah.
And I've been here a lot, so.
Yeah. So I got good news, Bradford. You have a med review on Monday.
A what?
A med review
Okay.
on Monday with Dr. DeHaro. So I can put a note into her now. She's probably not going to make any changes until she sees you on Monday.
Mm-hmm.
But it looks like for some reason it doesn't have. Oh, it is Zoom. So it'll be Zoom.
Okay.
Okay. What
On
time
Monday.
is that? I want
It
to make sure I
is
have it on my calendar.
1:30.
1:30. Okay. 1:30. Let me go check my calendar. Make sure I have that on there.
All right.
1:30, Dr. DeHaro on Monday.
Have you been any hallucinations?
No.
Zoom with Dr. DeHaro.
Yeah, I did not have that on here.
Well, it's a good thing we mentioned it, right?
Thank
Indeed.
goodness. 'Cause hopefully I think they got it all set up with my email, so I would have gotten a notification probably Friday and been like, what is this?
Right. Well, I think that happened with Steve last time, where we didn't get the notifications, neither one of us did.
Mm-hmm.
And that same thing happened where we were like 15 minutes late to the med review.
Right. Okay. Yeah. All right. So now it's on there. So we got it. Because you also have another appointment that day too, but it's the only there was a. Forgive me. So
Okay.
I'd have to go look at his BM chart, but I know that there was a few days there, and I want to say it's been within the last few weeks.
Okay.
I've been here so much, my days are kind of running together.
Yeah, I know the feeling.
But I know there was a day that he or a couple days where he was coming out pretty regular and having me check his BMs, and they were pretty loose.
Okay.
But that's the only time, just that one time.
Okay. But he
usually
reports
he's been pretty
that
good about it.
happens 2 or 3 times a week. So, I mean, why don't you report that every time it happens so that way we can get a more accurate...
I've been starting to do that.
Okay, awesome. And then that way we can get a more accurate idea of how bad it is. And I would say it's probably a pretty good idea to not automatically assume that it's the medication that's causing this, and to allow a primary care physician to do a checkup to see if there's any other issues, like a blood work or maybe a stool sample or something. That,
Well, I'm getting regular blood work done.
okay. Yes.
And no one else seems to be getting sick, so I'm pretty sure it's not the food.
Well, yeah, but it could be something else. That's why.
Yeah, it could be something internally that we don't know about.
Yeah, so
You know,
maybe
'cause
getting
everybody, the older we get, the more our bodies start to change.
yeah.
So it could be anything. So we'll have to check and see.
And it might, if it is the food, it doesn't have to be something that's wrong with the food. It could just be your body's response to that food, and you might not know that you have that reaction to that.
Yeah.
So it could be so many different things. And right now, I mean, the medication, you've been pretty consistently on the same medication.
Mm-hmm.
So not saying that it's impossible that it could be caused from the medication, but I just would urge you or encourage you to keep an open mind to look for other possible reasons that this may be occurring.
All right.
That's awesome. Thank you.
You're welcome.
So do you have a follow-up with primary care?
Got my calendar right here in front of me.
Oh, okay.
Okay, just a second. I know he sees that. What is it? Is it hematologist?
The blood work.
Yeah, I think that's Monday.
Okay.
And I don't have anything with Dr. Lisa, but it might be in her, because there's a lot of appointments that are missing on my calendar.
Okay.
So I can look in her calendar and find out, because I have a couple other ones, but not Lisa suing.
Okay.
And if I don't have anything and there's nothing scheduled, we definitely can do that. And get it
Does that
scheduled
sound
tomorrow.
good, Bradford? I mean, it's better to know. I mean, just automatically assuming it's the medication is leaving other possibilities unchecked. And then if it isn't the medication and it is something else, catching it early on could prevent further complications.
Okay.
So, and if it turns out to be the medication, then that's knowing that, ruling out these other things will allow the Dr. DeHaro to make changes to that medication. Not necessarily saying that it's going to be the medications that you've been requesting.
Well,
But-
medications that help. It's,
Yeah, because it might not necessarily be the two that you've been requesting. I think she's already kind of been clear that she doesn't believe that those are options to treat the symptoms that you present.
I'm finding that the medication that she's been prescribing isn't helping. So
Yeah.
we
And-
know one thing helps. Like I said before in other meetings, we know it works. It's already been tested and proved. It's just a matter of getting back to proper practice.
Yeah, I understand that, but I do want to point out you seem extremely well today. I mean, just the presentation that you have right now, you're making good eye contact. You seem healthy. You seem like you do have some energy. So today definitely is a good day. I have to say that.
Not as good as it should be.
It never is, right?
Oh, come on.
That's for sure.
It never is. It always should be better. But you're doing really. I just wanted to point that out. You're doing really good, given the circumstances.
Appreciate it.
And I can tell that you're trying really hard to make all of this work. Even though it's frustrating when you're dealing with so many different things with doctors and things like that. If they're not.
Helping.
Yeah, well, if you don't feel that they are,
Mm.
which it's very important to be patient and understanding in where they're coming from too.
I can appreciate, which is why I keep on telling him what would work. Because just getting to that resolution of having one thing fixed and then being able to start concentrating on all the other things.
Yeah. How is your pain level?
It's usually between 3 and like 7.
That's a pretty big range.
Yeah.
Like that.
Well, I'll be sitting up all day like if I were playing my game, and then when I go and lay down, it's like, whoa, I had no idea I was in so much pain.
Okay.
Might be the chair choice.
Yeah, that chair.
It
is
seems
probably
to
not
be
the
anything that I sit
Not
in.
the most
Oh, even your-
comfortable.
Even my
office chair.
office chair.
Okay.
So how did you actually break your back?
Stunt work, surgery, other things that family put me through.
When did the first injury to your back occur?
Well, it's about so tall.
So 5
Knee
or
high
6?
to a lamb's tail.
Knee
Yeah.
high- I haven't heard that one. I've heard the knee high to a jump though.
Oh.
Or
Yeah.
grasshopper.
Grasshopper,
Yeah, to a grasshopper.
Yeah, lamb's tail though. That's
Yeah.
So you're about 5 or 6.
If that. Maybe a little bit younger.
Okay.
It's hard to tell.
So there's definitely significant trauma
Indeed.
to the back. Yeah. And have you ever had a diagnosis for that?
Well, I was prescribed medicinal marijuana for it.
Okay. And that must have been before you came here.
Yeah, it was in Albuquerque, New Mexico.
Okay. How long ago was that?
A few years, maybe.
Okay.
Did they ever say anything about maybe it being arthritis?
Uh,
That could be the pain.
well, it started when I was small.
Like
Yeah, but
arthritis or
if there was
No.
an injury though, it could cause arthritis.
yeah,
Well,
really bad.
they started with an injury, and then, you know, doing what I do caused it to get aggravated and worse at sometimes, better at others.
Sounds like arthritis to me. I have
Well,
it.
yeah, an injury when that happens when you're young, it could eventually over time turn into arthritis because maybe the injury didn't heal properly, or there was scar tissue or something like that, which could cause the inflammation. So there's a lot of options. Again, so the thing about the treatment especially with mental health, there's a lot of guesswork. It's not something that they can take a test and be guaranteed to have something that's going to work 100% right away. So a lot of times
Which is why I want to use what's already been proven to work.
that's understandable.
Rather than waste my time on trying other things.
That's understandable.
I mean, it's getting close to, like, medical insurance fraud.
It's
when I
understandable
could
that
be taking these things that work. And because the doctors won't listen to what I'm saying, they keep on prescribing other things. And I don't want to get to the point where I'm refusing medication. But
Does Dr. Terrell do the swab test?
I believe they did do that.
What?
Oh, did they?
Very
To show what
yeah.
works and what
You're
doesn't
talking
work?
about the gene site testing?
Mhm.
Let me check to see if he has that in his chart. Because I believe that they did that really early on when you first came.
Let's see here.
Yeah.
Because I know that I've had that actually help other
Yeah,
people.
it works really well because it can rule out a lot of medications that don't have side effects, and it will. If you haven't had it, I would definitely recommend that we get it done. I mean, we would have to get
What is it?
Karen's permission.
All they do is they just like swab inside your mouth,
mm-hmm.
and then they test it, and then it comes back. It lets you know what meds work for you and what don't work for you.
Oh.
Yeah.
Hmm.
If you've been on them before, you know what works with your body chemistry.
Yeah, so it takes out a lot of the guesswork. So what it'll have is based on your genetic code, it'll show different levels of how effective certain medications are for you based on research.
Hmm.
So some of us have very similar genetic codes, and the medications that have been known to work for people that have that genetic code will show up in a certain way on the test. And then others that have potential side effects, it'll show like these cause this to this type of person. And it'll be, it's very, very good. I'm glad that they came up with that.
I just thought maybe that would be a good idea.
Yeah, I
just
thought.
so that he has like
So if you haven't had it, which I'm not seeing it in your thing, so what we can do is maybe we can bring it up on Monday, and Dr. DeHaro can request it, but we also have to get Karen's permission for that, because she would have to approve it, which I don't see why she wouldn't, but
Yeah.
we still have to go through the process of asking her for maybe to sign a consent. But she could probably give verbal consent over the phone, and then we could mail her a copy of the consent, like we have in the past. If you're okay with it.
That'd be all right. 'Cause then at least you'd have some kind of proof, you know, if it works for you or not.
Well, I know it does.
Right. No, I mean like the medications you're on, or if it's, you know, anything like that that could be causing you not to feel well and stuff like that.
Okay.
Yeah,
That'd
because
be
you don't
nice.
want to
That way
continue
you're
to have
reassured.
these symptoms if there's a way that you can get on something that's better.
That
Yeah.
is what I'm trying to do.
But I do have to say though, I think that some of these medications are helping you in a little bit.
How
Just
so?
From the time that I met you to now, as far as the way that you present, the amount of symptoms that you report have gone way down. And I think that part of it's a lot of it's to do with you, with the effort that you're putting in, but I think part of it also has to do with the medications, with the way that they regulate the chemistry in your brain.
I don't agree, but okay.
That's okay.
Okay, are you done with me?
Yes.
Okay.
Unless Bradford has anything.
You have anything?
No,
else?
I think we're okay.
All right.
Thank you.
You're
Chantal.
welcome.
in my car. I know it's